Probably, I still feel some anxiety when I go out shopping because I'm not really sure about what other people have been doing, which is probably why I don't.
I don't think it's going away anytime soon.
I'm over it. I'm not gonna lie. Like I'm sick of being sick. I'm sick of being sick. And I'm mad too because I think honestly our peak probably was hitting, I'd say February, March, April. That's actually a peak we had.
It's obviously is a real thing. There's all these theories about it being a hoax and all this stuff. And then, I mean, it's a real thing.
From what I've seen in my friend groups, people seem to be taking it a little bit less seriously than they used to. And for me, that worries me, honestly, because that's kind of how we got here in the first place.
I really am, nervous about our future because I keep reading the numbers. Being broadcaster, I'm seeing it every day when I go to work. And, the first thing I do as I step in the door at work is got to wash my hands, got to use a sanitizer, got to wipe down the surfaces where I work. And it's like, I'd really like this to just go away.
I'd say I have felt the same. Like it sounds kind of funny saying that as somebody who got it from going and being social, but this was like before we had shut down anything that I went out. And even then I was a little hesitant, but I'm like, you know what? There's only one case in Saskatchewan. It's probably okay. I'm not going to go out after this weekend if things are getting worse. And I didn't, but that one time was enough. But even still, since I'm still cautious about it because we don't know enough about this disease to know for certain if I can't get it again or if I can transmit it still, even if I've recovered. There's just so much uncertainty that I am still following all the regulations of reduced contact. If you're visiting with people, it's spaced out. Keep that bubble of 10 or 15 people. So it hasn't changed a lot, but I also was an early adopter of COVID who got it really fast and didn't have much time to think it wasn't that big of a deal.
I think that if people are safe and wear masks and wash their hands and do their part to stay safe, I mean, gosh, that's all you can do. But I'll still live my life and leave my house and work and do what I need to do.
I think there's a big education gap in terms of what is a virus, how does it operate on living systems, what is a vaccine, how does a vaccine operate in living systems, and there's a lot of disinformation, misinformation, and general fear around all of it.
So I'm back in Ithaca planning to try to take classes either hybrid or fully online. And I'm depending on my peers to keep me safe, as well as they're depending on me to keep them safe, right? This is not something that's going away. We've seen, there's been a lot of young people recently that have contracted it and died. I don't want to die. So I'm definitely scared of it. But again, trying to take as much precaution as I can in my own life.
I don't feel they acted fast enough. There could have been a lot more done. I think testing should have been available right from the get-go once they first learned about it. I found our healthcare professionals, I get it, their hands are tied in Canada. They have to kind of follow rules and stuff. But I just found them really slow to react to it.
My family and we got it at the start of the pandemic. So it feels like it was just so long ago now where, I tried not to think about it too much anymore. But, it is just worrying because, school is going back and, the cases keep happening. It's just something that's kind of going to be with us for a while. And, we have to live with it. And I think people are being smart for the most part about, cleanliness and hygiene and trying to avoid it. So I think that's a good thing. But, it is scary to see what it can do to yourself and to your loved ones. So I think that's the thing that just sticks with me the most, where, it's not necessarily a fear, but you just don't want it to happen to anyone else.
I just wish that people would take it a little more seriously. Unfortunately, you hear the stories, you see the stories, you probably reported a ton of them that, people that don't believe, and people think that it's a conspiracy and this and that. And I just wish all that negativity could go away so that we could focus, positive and being positive about it.
Whether it deserves the attention and the cautions that we're giving it as a society, hard to say. If you look at numbers of other causes of sickness and death, coronavirus is not up there with some of the other leading causes of death. Yet we're going these extremes with precautions. So I don't know. There's questions. I don't have a set opinion on it or anything like that as far as what we should or shouldn't be doing, but it's curious to me why we're doing these things when there's hard evidence of more serious causes of death and illness.
I got some anger issues over this because, had I not been able to take that time off, I never would have been able to go to work. I honestly, for 3 months, I would not been able to go to work. There's just no way. I was that sick.
There is no historical reference for how this is going to play out. Whereas if you were to look at the flu, polio, measles, smallpox, all these diseases, we have so many historical records. We have numbers, statistics, data. And for this, it's all in real time. And many folks fail to understand the role of science here. The role of science is to seek the truth. And right now, it's a mystery. So as we seek out the truth, things change. We expect science to have an answer for everything. The idea that our health officials are going to come out in March and give us all the information we need to know. And then they go back and change it. And we think, well, if you're going to say now we need masks, is anything you're telling me true? And the answer to that is, it's a process. Our best information right now is what we're working on. And we need to be flexible. We need to understand that it's going to be messy, that we need to be flexible and understand that we can't have rigid understandings of this crisis.
I've sewn a lot of masks. I like to sew. I have tons of scraps of material, cotton and things that I've been making all kinds of masks for adults, large, medium, and small. Let's put it that way. My granddaughter has a variety of masks that match outfits that I've made for her and things like that. So she can be very cool. But for people going into businesses and refusing to wear masks or refusing to or getting mad at people because they want them to wear a mask. It's like, if they want you to wear a mask, you wear a mask. If you don't want to wear a mask, then don't shop there. It's simple. But for people to get upset about it just seems, it seems kind of ridiculous to me. Maybe because, like you say, I have experience with COVID. Maybe I have a slightly different view of it because members of my family have suffered from it. And obviously, my husband died from it. So it's difficult for me to believe that people would fight that.
I think on most cases, like life, you can find the negative, and of course, having it, I could really find the negative. But I'm kind of more of a cup half full, so I think other than it can be deadly, but it can be under control too, kept under control. And I think it really has, for me, really stopped my world quickly, but made me rethink and revalue what is important to me in my life. And I found out that family and friends and my kitty cat is very important to me. And we did find, I think it also taught me how to go a little bit more outside of my box than I normally live. And I had to rethink how you do things and how you function. And I still did the community garden. I got involved and worked with the COVID-19, being that I was involved with it personally, that I helped us be able to have our community garden in Saskatoon. So, you know, I wasn't afraid of it, but I just learned how to work around it. And I still think that it has done that for everybody in the world, that it's kind of put us all in the same field of that we're all in the same. It doesn't matter if I have lots of money or not, no money, or if I can fly to Rome or not fly to Rome. It kind of put us all where we had to stay into our condo and into our house and into our little bubble. And so it taught us a lot of things about what's important.